dive deep into this big LGBTQ story for today. I'm Von Biggs, and let's queer up health. Screening at 35 could cut anal cancer deaths by 65% in gay bi men with HIV. A new study is shining a powerful light on anal cancer prevention, and it could save lives in the LGBTQ community. According to the research published in the Annals of Internal Medicine, starting anal cancer screening at age 35 for gay and bisexual men living with HIV may reduce death rates by as much as 65%. Anal cancer cases in the U.S. are on the rise, with over 10,000 new cases each year and mortality increasing at more than 2.5% annually. Men who have sex with men, especially those living with HIV, are at particularly high risk. The study used a microsimulation model based on data from the landmark Anchor trial and other sources. Researchers compared 52 screening strategies, including the costs, outcomes, and life years gained. The bottom line, screening at age 35 with anal cytology proved more effective than starting at age 40 or 45. Several approaches, including annual or biennial screenings using HPV testing or cytology with HPV triage, showed meaningful reductions in cancer cases and death. Dr. Ashish Deshmukh, professor of the Medical University of South Carolina's Hollings Cancer Center, said, ICER, or incremental cost effectiveness ratio, is a way to measure whether a medical intervention is worth the cost by comparing how much it costs to how much it improves the health. That improvement is measured in QALYs, which stands for Quality Adjusted Life Years. QALYs reflect both the length and the quality of life gained from a treatment. In this study, starting anal cancer screening at age 35 for gay and bisexual men living with HIV was shown to be cost-effective, with an ICER under $150,000 per quality gain. This means that screening provides more value for the investment and has the potential to save lives while using healthcare resources wisely. Right now, there are no national guidelines for anal cancer screening from bodies like U.S. Preventive Services Task Force of the American Cancer Society. Deshmukh hopes this study changes that. Quote, our study addresses the long-term uncertainty and knowledge gap about whether screening for anal cancer reduces mortality. This suggests that we may need to reduce uncertainty around uniformly screening for anal cancer at high-risk individuals, especially for MSM with HIV, end quote. For LGBTQ people living with HIV, this research could help shift the conversation and policy toward earlier life-saving care. You can read the whole article at healio.com. You know, Bonnie, I was thinking about as a fellow bottom.
Crazy transition.
Okay. Dead accurate.
Go on.
But anyway, I thought about this and I was doing some studies and I thought, is there some type of thing that ties the fact of bottoming, just in general, being a bottom, anal sex in general, to this, because versus it just being LGBTQ focused. And, what I found is that, especially MSM, who, when they're having anal sex, the doctors ask those questions when they're seeing their gay doctors. So those are the type of conversations they're having. But in a heterosexual world, those questions aren't happening.
Nope.
So, and we do know anal sex happens in the heterosexual market. So it seems like while it shows a larger rise in LGBTQ, it's just that we're screening more of us. But right, and it just means that the earlier we can catch it, the better. And we know that from any cancer, cancer prevention. So.
Yeah, no, and with everything, with all the cancers, they have lowered the ages of screening for everything, right? Like I'm a breast cancer survivor, and they lowered the breast cancer, if you have family history, down to 35 to 40. I mean, and that used to be 50 and 55. So that just tells you how, our food, environment, all kinds of shit are making, are making cancer more prevalent. I mean, nobody doesn't know somebody who has lived or thrived or died from cancer at this point, So, I mean, just telling gay boys to get themselves screened cuts deaths by 65%. I mean, take that in.
Right.
That's crazy. And going back to, here in South Florida, we're so blessed that we have LGBTQ plus providers. Folks out there, find LGBTQ plus providers. I urge you, I plead with you, unless you have the best doctor that knows you and is versed in our community and knows what to ask and has made it a point to educate themselves. You know what I mean? Like not ask you over and over again, is there any possibility that you might be pregnant? No, bitch. No, there isn't. Trust me, we've tried. You know what I mean? Like, but you can, like, Like in this day and age, you can find that,
Yes.
right? And you can have these conversations that you might not be okay having with a white old lady who is your PCP. You know what I mean? Like, you know, a lot of people like suffer in silence because of that. And they go to their doctor and go, how you doing? Fine. You know you're not fine.
Right.
Mm-hmm. Well, you know, the quali thing that they put up there, which was, it's basically that ratio of like a recall in a car. It's like, well, how many people like are going to actually die to make the lawsuit worth the amount of money, right? When you feel like you are in a statistic that might be susceptible to cancer, you go and get your screening done, right? And I was in a situation, maybe when I was about 35 years old, where a lot of stuff health-wise was going on with me, and I wasn't sure exactly what was happening. And so I was with a gastroenterologist, and he was like, "Oh, you're too young for any kind of screening like this." And I was like, we're gonna have this screening." And he said, "Well, I could probably make it work. Like, do you have a family member who had this XYZ? I have a huge family. I have a family member who went through everything, right? So I'm like, oh yeah, I got a cousin, down the street. He had something. All right, fine, And it was worth it to get those screenings. So you're always your own health advocate. Right. Another situation, because talking about anal cancer, which comes from HPV, is the Gardasil is available. Yes. And during the pandemic, I mean, I was 40 plus at that time, and I saw Gardasil, they raised the age for when you can get it. Now, they say it might be less effective as you get older because you might have already contracted whatever you're going to get with, in your 40s. But they've raised it now again to 45. So at 45 years old, you can still get this vaccine that prevents some head and neck and cervical and anal cancers. So make sure that you look into that, the Gardasil vaccine, and your age. And maybe if you had been in a relationship, the same, marriage relationship for 20 years or something, you may not have been exposed in the way that, other single people have been exposed. Or even if you are promiscuous, maybe you just didn't get that kind of, that type. It doesn't hurt for you to get it. So look into that.
What was the name of it again?
Gardasil.
And what was the other term that you used for it? HP something?
Oh, HPV. So all of these cancers
women
are
get that
HPV
too.
Right.
related.
Tampons. Yeah, you know what I mean.
There's like 100 types of HPV, viruses.
Yeah.
But Gardasil will prevent you from developing any cancers from the top 9 or so that are cervical and head and neck and anal.
Oh, that's good.
Yeah, and as a doctor's wife, I've had so many conversations with my husband that I couldn't have with a general practitioner, because I feel comfortable talking to my husband about this is what I put in my butt and this is what I'm feeling and this is what we need to get checked out.
And he's the one who put it there.
He's the one who put it there. So he knows exactly what's going on with my body. So to have these candid conversations with your queer medical providers, like they said, it is so important to have a queer provider so that you don't feel self-conscious being like, I just had a 50 load weekend and I want to make sure I can live to see tomorrow. Tell me what I need to do. Tell me what I need to take. And that medical provider should not be judging you at all.
Nope.
They should be helping you live your best life for as long as you possibly can. I've had a general practitioner who literally, I told him the circumstances of my marriage, which is open. And his medical advice was, oh, you should close it.
He just went.
With what face do you do that?
So you know nothing about the community. You don't know anything. Had no idea what PrEP was. What docs had never heard of any of that. And I'm like, you're a whole doctor, a whole entire doctor, and you don't know what any of this is.
And there's no reason. I mean, we should not be slut shamed. We should not we should not feel that way. Okay,
Right.
You should go to a doctor that goes, yeah, I had 50 loads in my back. Okay, no problem. Take this.
I got the shovel and
it's not even a blink. You know what I mean? And some of the doctors that I know probably were there too over the weekend. You know what I mean? I'm not going to mention any names. So, you know what I mean? Find those. I'm looking at you, Vaughn.
But I'm not a doctor.
But he knows who I'm talking about. That's why I said that. But find your crew, find your tribe, even when it comes to, medical stuff. So do that. And that is the big LGBTQ story for today. There is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by subscribing and sharing Queer News Tonight.